Hello everybody, my name is Diana Soto and I am a student through Indiana State University's LPN to BSN program. Today I'm going to be talking about the human papilloma virus, otherwise known as HPV. The following are some of the learning objectives that I'll be going over for this presentation. Number 1, the audience will learn what is HPV. Number 2, the audience will learn how you get HPV. Number 3, the audience will learn how HPV general warts look like. Number 4, the audience will learn about HPV possibly leading to cancer. Number 5, the audience will learn how to prevent HPV. Number 6, the audience will learn about appropriate age range for HPV vaccination. And number 7, the audience will learn how HPV is detected. Before beginning the presentation on HPV, be sure to click the link below to begin the pretest. What is the human papillomavirus, or otherwise known as HPV? HPV is a group of related viruses, which is a sexually transmitted infection. So HPV is one of the most common sexually transmitted infection in the United States. According to the CDC, there were about 43 million HPV infections in 2018. Most of those people infected with HPV were in their late teens and in their early 20s. There are lots of different causes for different types of HPV. Some can cause health problems, including genital warts and cancers. There are vaccines to help prevent the prevalence of HPV in young adults and adults in general. How can you get HPV? HPV is a sexually transmitted infection that is caused through direct skin-to-skin contact with somebody who is diagnosed with HPV. HPV can be transmitted through vaginal, anal, or oral sex, again with somebody who is diagnosed with HPV. HPV can be passed even when somebody has no signs or symptoms, so it's important that you get tested regularly if you are sexually active or have multiple partners, because there are times when you do have an STI and you have no symptoms. And sometimes symptoms can take several years before signs develop. So again, getting tested is very important to help catch if you have one of these STIs. So you may be wondering, what does HPV look like? HPV, like I said, causes genital warts. On the upper left-hand picture of this slide, you can see what the HPV warts may look like. They can appear large, small, raised, flat, or cauliflower-like shaped appearance. Before HPV vaccinations were introduced, according to the CDC, 340,000 to 360,000 women and men were affected by these warts caused by HPV every year. So this is about 1 in 100 sexually active adults in the United States. How is HPV detected? In women, they generally find out they have an STI or HPV through a routine Pap testing. Pap smears are recommended for women who are 21 years of age and older, or who become sexually active before 21 years of age. From there, if you have normal Pap testings, then your doctor would recommend that you get tested every 3 years. And that may vary from a person who has an abnormal Pap, which they may want to be seen yearly by the doctor. HPV can be detected through routine physical exam. So if you see genital warts, your doctor may examine it and notice the physical appearance to be related to HPV. Right now, there is currently no approved testing methods for males. Some additional information about HPV is that men can also develop genital warts and HPV like women. Some doctors can do an annual pap test to check for HPV. However, in men, there is no approved testing for HPV. So if they are heterosexual and they have had anal sex, the doctor can check for anal cancer to see if the HPV has been introduced to that area. Warts can be surgically removed or freeze off, so they do not need to stay on the surface of the skin. The doctor can treat it in that sense. However, you can always have flare-ups of HPV, so you need to be sure to have your partner tested and also have yourself tested if you are sexually active. Something really important to point out is that HPV can turn to cancer. These once healthy cells become unhealthy and change their shape and form. This can lead to cancer. HPV can increase your chances for cervical, vulvar, vaginal, penis, anus cancer, throat, tonsil, tongue cancer, and more. So whichever area came into contact essentially with this HPV virus can cause the cells to change and morph to become cancer. HPV that causes genital warts are different than the HPV that causes cancer. However, you wouldn't know which one you have unless you do get tested. So how can you prevent getting HPV? Currently, there is vaccinations available for HPV. One immunization available is called Gardasil. This is a 3-series vaccination that is FDA approved and recommended by the CDC. The CDC recommends that this vaccination be given to children 9 years of age through 26 years of age. You can even start getting this vaccination between 11 and 12 years old. 27 through 45-year-olds can get this vaccination. However, it provides less benefits due to the likelihood of already being exposed to HPV. Routine screening for cervical cancer is recommended for women between 21 to 65 years of age. Monogamous relationships and latex condoms can be used to reduce the chances of getting HPV. But of course, the only way to know if you have HPV is by getting tested. Attached are some references available to you to look up more information regarding HPV. Thank you again for watching my presentation today. Be sure to click the link below to complete the post-test.